And not just any doctor. This is somebody you will recognize. 6.5 million Canadian adults do not have a family doctor or access to primary care. 6.5 million. It is an alarming number, and one our next guest is hoping to turn around. And if anyone is qualified to weigh in on such an enormous task, it is Dr. Jane Philpott. Dr. Philpott is laying out her vision and a way forward in her new book. This book is called Health for All, a doctor's prescription for a healthier Canada. Great to have you back with us here at Your Morning, this time in studio and not in a parking lot during your time during COVID when you were working. You know, we were just chatting about this. You come at it from a very unique vantage point. First as a practicing family doctor, then as a federal minister of health, now as the Dean of Health Sciences at Queen's University. You've spent a decade before that working in Niger. You've worked in the medical system all over, worked within government, working within the system. So what is the fix? It's hard to think of somebody who's more qualified to tackle this mission, because things are a mess.
Things are a mess. You're absolutely right, and thank you for having me. I think all of those perspectives really came together to allow me to put the prescription together for the book, because, of course, as a frontline care provider, you see that it's not working. And of course, you know, over the decades, it has become worse and worse to the point now that, as you say, 22% of Canadians don't have a family doctor or any access to primary care. But it kind of took that time in government and then also seeing things from the lens of the medical education system to realize, oh my goodness, there are actually solutions that would work. And we've been starting to talk about this model of the fact that every child has access to a public school. We have a system where we allocate schools according to geographic postal codes. And why couldn't we do that for primary care so that no matter where you move in the country, you will be assigned to a place that will provide you care by a primary care team? And I felt like the book and the solutions of how government needs to act to make that possible seemed to make sense.
I really love that concept of primary home care. Can you walk me through a little bit more of what that would look like? So let's say I move to Calgary, for example. What happens next?
So in the ideal world, which we're going to try to create together, when you move to Calgary, you would plug in your postal code to the website that would say, you know, here's the three primary care teams that are in your neighborhood. We'll assign you to this one. You can potentially choose a different one, but you'd start with this place. When you go to that primary care home, you will be embraced by a team where there would be family doctors, nurse practitioners, nurses, social workers, dietitians, depending on the needs of the neighborhood. And you would have a main person to whom you're assigned that you would build a longitudinal relationship with. But if one day you went in and your family doctor or nurse practitioner wasn't available, you might be able to see a nurse or one of the other doctors on the team. It would be that team-based care, a home where all of your healthcare needs could be met, except for the more extreme cases that needed to go to hospital.
When we start talking about making things better, often we talk about money. We just had a federal budget. We've seen the money that's allotted to healthcare. But you say we don't need a system that costs more money. We just need to use that money better. In this economy, people like the sound of that, but what does that look like? Does it mean money's being wasted now?
I hate to tell you, but money is not being well spent now.
Well, I have that feeling.
We can actually do more with less. This is not an imaginary scenario, because there are many countries in the world that do this, that pay either the same or less than we do and get better health outcomes. And that's because they focus on primary care. And, you know, it makes sense, right? What we're doing now is we're leaving almost a quarter of the population with no access to care. They're not being screened for diabetes. They're not being screened for cancer. They're showing up in emergency departments with end-stage cancer that is then untreatable. Whereas if they had a place to go months before when their symptoms first showed up, they might have been able to be treated, and it would certainly be less expensive.
Can I ask you about user fees? This is something that's just come into our sphere, but I know a lot of Canadians, you know, they used to be sort of occasional. Now they feel like they're entrenched and they're part of our everyday health care. Can we get rid of those and still have adequate health care?
Yes, we can. Again, you know, we actually have we're not supposed to have user fees for things that we deem to be medically necessary care. Now, we need to have a broader definition of what medically necessary care is, but we don't want people to have a disincentive to actually get that care in the early stages. And we know that things like user fees will actually put up a barrier, particularly for the most marginalized members of the community. Therefore, their conditions will get worse and be more expensive in the long run, so it doesn't save us any money.
You've got the insight, you've got the plan, you've worked within government. So if not through government to have a plan like this put in place, what are our avenues? What are our channels to get this done?
Well, ultimately, we need the political will to get it done. But I think the people of Canada have such enormous power. And what I hope that the book will do is to give Canadians that vision. And so far, the conversations I've had with Canadians have been delighted to realize that, oh, there is actually a plan out there. And I've had several people say, I'm going to read your book and I'm not going to give it to my member of parliament or my member of provincial parliament because this is what I want for my community. It's not even just caring for ourselves and our families, but we want our whole neighborhoods. We want to be a country that not only provides public education to all our children, but provides a primary care home for every person in the country.
Dr. Philpott, I feel like your time in politics, good and bad, was all part of an experience that led to this time in our healthcare system right now. Thanks for being here today.
Thanks for having me.
Just a reminder, Dr. Jane Philpott's book is called Health for All, a doctor's prescription for a healthier Canada. It's a plan you're going to want to read.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.